Good day, I'm student nurse Maria-Paula Valenzuela, and for today, I'm going to perform the preparing medications from Vials. And preparing medication from Vial involves knowledge and use of a sterile technique. Therefore, these techniques are not delegated to UAP or unlicensed assistive personnel. First, assess allergies to medication. And then specific drug action, side effects, interactions, and adverse reactions. Client's knowledge of and learning needs about the medication. And then intended route of parenteral medication to determine appropriate size of the syringe. And then ordered medication for clarity and expiration date. And then prepare the materials or equipments needed. Then we have the client's MAR or the medication card. We have also the vial, sterile medication. And then we have also the antiseptic swabs. And we have also syringe, sterile water, or normal saline if drug is in powdered form. And then check the MAR or the medication card. Check the label on the vial carefully against the MAR to make sure that the correct medications is being prepared. And then we will follow the 3 checks for administering medication. First is when it is taken from the medication card. Second is before withdrawing the medication. And the last is after withdrawing the medication. And then we will now perform the hand hygiene and observe other appropriate infection prevention procedures. And then prepare the medication vial for reconstitutions. The rationale is preparation that have changed in appearance should be discarded. And then read the manufacturer's directions. And then remove the protective cup or clean the rubber cup of a previously opened vial with an antiseptic wipe by rubbing in a circular motion. The rationale is the antiseptic cleans the cup and reduce the number of microorganisms. And then withdraw an equivalent air from the vial before adding the diluent unless otherwise indicated by the direction. And then add the amount of sterile water on a saline or diluent indicated in the direction into the vial and observe sterility. And then mix the solution, rotating the vial between the palms of the hands, not by shaking. And then withdraw the medication. Ensure that the needle is firmly attached to the syringe. Remove the cap of the needle, then draw up into the syringe the amount of air equal to the volume to the medication to be withdrawn. Carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. Then, inject the air into the vial, keeping the level of the needle above the surface of the medication. The rationale is the air will allow the medication to be drawn out easily because negative pressure will not be created inside the vial. And then withdraw the prescribed amount of medication using either of the two um, methods. Then hold the syringe and vial at eye level to determine that the correct dosage of the drug is drawn into the syringe. And then eject the air remaining the top of the syringe into the vial. And then when the correct dosage volume of the medication plus a little more is obtained. So let's add 0.25 ml. And then withdraw the needle from the vial and replace the cap over the needle using the scoop method, thus maintaining its sterility. And then, if necessary, tap the syringe barrel to dislodge any air bubbles present in the syringe. The rationale is the tapping motion will cause the air bubbles to rise to the top of the syringe where they can be injected out of the syringe. And then if giving an injection, replace the needle with a new one of the correct gauge and length. And then eject the air from the new needle and verify the correct medication volume before injecting into the client. And then if multi-dose vial is reconstituted, label the vial with a date and time it was prepared, and prepared the amount of drug contained in each milliliter of solution and your initials. The rationale is time is an important factor to consider in the expiration of this medication. Once the medication is reconstituted, store it in a refrigerator or as recommended by the manufacturer, and then discard the materials used to a proper receptacle, and then um, perform hand hygiene, and after that you will now document.